Great. Okay. So the release of the type 2 diabetes in Manitoba report was the catalyst, excuse me, for our region to re-examine our current approach to diabetes and renal disease. We used a population health promotion model as a framework to develop a new pilot initiative. The one thing I do need to point out is that we are just beginning this journey, so we don't have any outcomes to report at this time, but I am able to provide an overview of our process thus far. We began by articulating our values and assumptions, namely that we should all be as healthy as we can possibly be, that equity is a good thing, that with adequate information, people will make healthy choices. And through anecdotal information, Indigenous people access primary health care services less often than non-Indigenous people. Examination of the type 2 diabetes in Manitoba report identified several key findings. Ambulatory visits to primary care providers for First Nations people in Prairie Mountain Health are the highest in the province, which dispels the myth that First Nations people are not accessing primary health care. This finding raises a question about the quality of primary care that is provided at those visits. Prairie Mountain Health is worst in the province for many metrics within this report. For example, First Nations people in our region have the lowest specialist visit rate in the province. Prairie Mountain Health has the highest rate of inpatient hospitalizations for First Nations people with type 2 diabetes. Prairie Mountain Health has the highest rate of ambulatory care sensitive condition hospitalizations for First Nation people with type 2 diabetes. The take-home message is that our current supports and services are not producing the outcomes that we anticipated for First Nations people living with type 2 diabetes. Through discussions with service providers over the years, we know that many healthcare providers are frustrated with the current service delivery. We know that as a health system, we don't know what else to do. There is a stigma associated with diabetes in many First Nations communities that Chelsea Ruth referred to earlier, and that culture and traditional practices are integral to better health outcomes for First Nations communities. Based on the quantitative and qualitative data available, evidence informed our decision to invest in planning a new approach to diabetes and renal disease services. Our business planning team, that was formerly the Planning and Innovation, identified two quality teams with a vested interest in diabetes: our primary health care and our population health and wellness. For our May 2021 accreditation process, the primary health care team chose to focus on diabetes, and the population team chose to focus on renal disease. Our planning team recognized that the social determinants of health are the key drivers for both diseases. Collaboratively, rather than specific silos, we will likely achieve more effective and efficient interventions. Our team arranged a joint meeting of the two quality teams, and we presented findings from the type 2 diabetes in Manitoba report. We proposed a joint pilot initiative to address the overall health trajectory for the client, rather than by specific disease or by quality team as we've structured them. This approach is well aligned with our organization's commitment to people-centered care. Our healthcare system often works at the individual, family, and community level. The Type 2 Diabetes in Manitoba report provides compelling rationale to prioritize the health of First Nations people and address diabetes and renal disease within the context of community. We also recognized the value of engaging with other sectors and systems so that we can achieve the maximum potential of any initiative. To that end, a team member drew our attention to the Indigenous Partnership Strategic Framework that was recently developed by the Indigenous Health Portfolio with Shared Health and Manitoba Health. This is an excellent roadmap to guide our efforts with First Nations communities in a culturally appropriate, respectful, and meaningful way. It will also help us seek opportunities to honor the Truth and Reconciliation Commission calls to action through intentional actions on our part. Evaluation is a core component of the Indigenous Partnership Strategic Framework. Our portfolio will develop a comprehensive evaluation plan for this initiative, working with a First Nation community, and these findings will provide a foundation for spread to other communities throughout our region. Another team member shared a new resource called the Rural Health Service Decision Guide that was recently released by the Canadian Institute for Health Information. We are keen to pilot this tool because we have no mechanism to determine what services are needed and how much service is reasonable for rural communities. Yet we understand the need to build community capacity to support health transformation in our region. Strategic actions from the Ottawa Charter for Health Promotion are integral to a new comprehensive service delivery model. These actions include develop personal skills, create supportive environments, and strengthen community action. As a service delivery organization, we have much to learn in terms of reorienting health services, because that requires us to change and not the client so much, and healthy public policy. Despite our corporate commitment to the strategic goal of improving health status and reducing disparities, we have not redressed health inequities amongst Indigenous people in our region. Through this pilot initiative, Prairie Mountain Health is committed to learn how to work in a truly respectful partnership with a First Nation community, how to offer and support effective and meaningful health services, and how to ensure equitable allocation of health resources in rural communities. We believe that these lessons, combined with intersectoral partnerships, including the Manitoba Centre for Health Policy, Shared Health and Manitoba Health, and the Canadian Institute for Health Information, will lead to health and social reform at a societal level. Thank you.